everybody. Welcome to the EM Code. I'm Dr. Vajiha, emergency physician by occupation. Join my quest in asking right questions from right people to get right answers. Our guest for today is Dr. Alaina Rajagopal. She is an emergency physician with a background in tropical diseases, paleontologist, and a fellow podcaster. Well, I welcome you to the EM Code, Dr. Brinde.
First, thank you so much for having me. Really appreciate the chance to talk to you, especially from so far across the world. So I hope you guys are all doing okay. I know things have been pretty rough.
Coming to the first question, what was your first experience like when you walked into emergency first? What was the exposure like? What were your feelings then?
So when I first walked into the emergency department, I was still a graduate student. So I had just started thinking about going into medicine, and so I still needed to study for the MCAT, which is our medical school entrance exam. And I shadowed a friend that I worked with at Johnson Space Center in Houston. And I just remember walking into the emergency department, and it was just kind of chaos. There's people everywhere, patients everywhere, and just kind of running from one bed to another. There were a couple of codes. So it was really new and really exciting. And I had a ton of questions about what was going on and why we were doing certain things for certain patients. So I was really intrigued from the start. And so that was kind of my first experience into medicine when I seriously started thinking about going into medicine. And I always went back to emergency medicine after that. I really liked it.
That's pretty unconventional, but a good experience, I'd say. Moving to the next question about your podcast, The Emergencydocs. Tell us about it and what were your objectives when you first started it?
So my podcast is called the Emergencydocs podcast, and we started the podcast in March of 2020, just kind of in response to all of the confusion and chaos about the COVID-19 pandemic. And so I have a background in virology and public health and global health and travel medicine and tropical medicine. So I felt like this was kind of my wheelhouse. And especially being in emergency medicine where we see a lot of these patients and we're the first people to see the patients. I kind of felt like it was my responsibility to help educate and do what I could to get good information based off of scientific data out there. And so I know it's been kind of confusing because a lot of the regulations have changed over time as well. And so we base that on science, on data as we get that information. And so we've really tried to use the podcast to update what all of these things mean as new data has developed and kind of come across the literature.
I guess it was a pretty good idea with all kind of rumors walking in and somebody with a background in virology talking about it actually makes sense. And since you were into the ED as well as with the background you have, I think it was a pretty cool initiative. Now starts your unconventional journey. You have been a visiting consultant in Caltech. So how did you land up there? What's the connection? What do you do there basically?
My connection with Caltech is actually my husband. So my husband went to Caltech for undergraduate and grad school, and so we're both visiting faculty there now. And Caltech has been incredibly supportive of the work that we're doing and helping us with sort of developing new ideas. And so we work there with a few other faculty in machine learning and electrical engineering to develop technologies and tools that can be used to help clinicians practice medicine, particularly in remote locations. So the idea for our work there came from a lot of my work in the developing world, where I felt like I was in these remote clinics, remote outposts, and I didn't really have the tools that I needed to treat patients there. In the US, if I want almost any lab, if I want any imaging, I can get it. Maybe not easily, but it's there and I have access to it. And in a lot of these remote locations, if I feel like somebody needs more testing or imaging, it really sometimes comes down to deciding, is it worth them spending their life savings to travel to a center that has these types of technologies and tools available? And I don't want patients to have to make those decisions. So we started talking about using ultrasound as a really very dynamic diagnostic tool where you can use it on almost any part of the body and get some diagnostic information. And so we're working with molecular diagnostics as well as ultrasound to develop new tools that can help clinicians working in remote places. But I think these tools will also be really useful for people in the developed world as well.
It's a pretty cool initiative. I think the medicine department should actually work hand in hand with the IT people so that a lot of artificial intelligence devices can be developed to reduce the cost and make things faster for the diagnosis and the treatment of the patients. Now I have a jigsaw for you. Biomedical science, emergency medicine, biotechnology, aeromedicine, NASA, Kalamazoo, global health. Can you please help me solve this?
Yeah, so paleontology, biomedical science, NASA, Kalamazoo, aerospace medicine. I have definitely had an interesting journey. So I've always been a science nerd ever since I was a little kid, and nobody in my family really worked in science. So I kind of had to find my own way. And I think a lot of what I was inspired to do in science came from film and television. So I remember the very first time I ever thought about going into medicine was when I was a little kid and I'd just seen the show ER. Turns out I became an ER doctor. But that was really the first time I thought, wow, that looks really cool. And these doctors are out there really making a difference. And so that kind of stayed in the back of my mind. And then I remember seeing Jurassic Park and learning what a paleontologist was and learning about all of these different dinosaurs and how cool it was to be able to kind of go back and figure out what had happened thousands, millions of years ago. So um, I, again, really credit film and television for directing me on that path. And I ended up working in paleontology in college as an intern at the University of Chicago. And then also in my childhood, I saw Apollo 13, and that was really a point in my life where I thought about spaceflight and how exciting spaceflight can be. And I mean, it's the definition of exploration and adventure. And so I remember seeing Apollo 13 and thinking, yeah, I really want to be an astronaut. And so that stayed with me and still kind of is with me to this day, where I ended up working at 3 different NASA centers in undergraduate and during graduate school and doing a lot of different space research, studying aerospace medicine. So I think those have all sort of been common themes in my life. I grew up in the Midwest, South Bend, Indiana, and so I ended up going to school at Kalamazoo College, which is in Michigan. So it's pretty close. It was a couple hours from where I grew up. But I loved that Kalamazoo gave us the opportunity to study abroad. Like 85% of students study abroad there. And I knew that was something I really wanted to do. And so I went and studied abroad in Kenya. And working in Kenya was really my first experience into medicine in the developing world and interacting with patients who had to walk miles and miles and miles to get to a clinic that still didn't have that much diagnostic technology available, and seeing kind of the suffering and the difficulty for people and patients. And so that was another thing that sort of set the wheels turning in my mind about wanting to go into medicine. But that was earlier on. And let's see, what were the other themes you brought up? And the research. So, I mean, I love science. I love being able to ask a question and figuring out the answer to it. And I credit my mom a lot for that. When I was a kid, I had lots of questions. And rather than answering them, she would always tell me, go look it up. And so we had a great set of Encyclopedia Britannica encyclopedias. And so I would go to the encyclopedias and try to find the answers. And if I couldn't find an answer, she would say, well, let's come up with an experiment to test this. And so that was a lot of my childhood. And I think that really made a difference in growing up to be a curious person. And so that's kind of where the research started. And then when I went to college, I interned at Kennedy Space Center, the University of Chicago, NASA Ames Research Center, Fairchild Tropical Garden. So I worked in diverse scientific fields. And I think learning about all of those different fields really went a long way toward helping me have a really strong background in science and then sort of honing in the types of things that I'm really interested in. Because if I'm being honest, I'm interested in everything. I don't think there'll ever be a time where I'll focus as much as everyone always told me I needed to. But I think being curious is a great asset to being a scientist. And so that's kind of how I got to where I am, and part of that sort of circuitous path to all the things that I've done.
That's actually too much for a curious person, also. I've not seen somebody go to so much for the sake of curiosity. No wonder you were a science nerd. Then, with all this happening, how did emergency medicine just click?
Yeah. So emergency medicine came in around the time I started thinking about going to medical school for real. So I was about halfway through graduate school. So I was working on a PhD in public health, virology, and space life sciences. And so that was at the University of Texas, but I was doing all my work at Johnson Space Center. And I had a moment where I was sitting in the lab, and I'd probably been in the lab for, I don't know, like 16 hours that day. It was a period of time where I realized I'd gone like 3 months without seeing daylight because it was winter, and I got to the lab before it was light, and I left after it was dark. And the lab is in this really dark building. So in any case, I'd been doing a lot of really long hours, and I remember sitting at my bench pipetting and thinking about naming my pipettes. And so I kind of sat back from the counter and was like, well, I think I need some more human interaction. And so that just sort of really sent me down a path of trying to figure out what I wanted, what I was trying to get out of graduate school, and what I wanted to contribute to the world. And ultimately, I realized that I really like human interaction. I like being around other people. I like helping other people. And so I started to revisit medicine again and that kind of thinking about it. Uh, and so I decided that while I understood virology and immunology pretty well, that I really wanted to understand how those systems sort of interacted with the rest of the human body. I felt like I had one puzzle piece and I needed the rest of the puzzle. So that was kind of the final decision to go to medical school. So while I was in graduate school doing my candidacy, writing my dissertation, all of that, doing all of the experiments, I was also studying for the MCAT and taking the MCAT and doing my medical school applications. And so I couldn't have asked for it to work out better, to be honest, because I got very lucky and ended up getting into medical school and finishing my PhD like a month before I had to start medical school. So it really, thank goodness, worked out. And, I had some advisors who really helped me along the pathway to get there. But when I started thinking about medicine, I knew some people who worked in emergency medicine and internal medicine. So I started shadowing those people. And I remember that first moment I'd walked into the emergency department shadowing, and I just really fell in love with emergency medicine. And I loved that it was fast moving, and you never really knew what was walking in the door. You didn't know what was going to happen 5 minutes from now. Nothing was scheduled or planned. And that really appealed to me. And it also really appealed to me that people are undifferentiated when they come into the emergency department. Somebody comes in and says, I have a pain here, or I have a pain here. And so it's your job to figure out what that pain might be, and if it's something that needs further intervention right now, or if you can wait a little bit before getting further treatment or diagnostic tests. And so I really liked the detective work associated with emergency medicine. And so when I started medical school, I still had an open mind. I was kind of thinking of either going into infectious disease or emergency medicine. And I found that I really just liked everything, every specialty that I went into. And so I decided emergency medicine would let me get a little bit of everything. And so I would really get the opportunity to keep practicing all of those different specialties, even if it's just sort of on a superficial or surface level. So that was another thing that drew me to emergency medicine. And here I am.
I'm sure it took a lot of courage and resilience to say, I'm not going to do this because I'm burning out and I need to change my specialty. So, choosing emergency medicine as a specialty after observing everything was also a very wise call. And moving, and let's talk about something related to it. How do you maintain wellness in a high pressure environment like emergency?
Wellness is really a challenge sometimes in the emergency department. And I think a lot of physicians and emergency medicine physicians have struggled with that over the last year with the pandemic. I always try to make personal wellness a priority. So for me, running is something that's really valuable. It's sort of my therapy time. It's a time to sort of process a lot of the things that happen during every day. But I also like yoga. I like reading. I obviously like film and television, and so all of those things help with maintaining a certain level of wellness and letting go of some of the more difficult or challenging aspects of my job. But I think you have to really schedule it. You have to make it a priority. And so whether it's taking 10 minutes or 2 hours to run or 30 minutes of yoga, I try to do something every day that's physical, because I find that physicality sort of is good for my mental health. But everybody sort of processes things differently and relaxes differently. And so I think that one thing physicians are really bad at is maintaining their own personal wellness and mental health. And so I think that's something that we've all started to pay a lot more attention to over the last year. And, I think that's something that we need to continue to talk about and push forward, because it's really difficult to tell a patient that they need to take time for their mental health and know that, I'm not taking my own medicine sometimes. So, yeah, it's something that I always work on. And I think, we, like I said, need to continue working on and talking about, particularly for physicians.